It's good evening, everyone. Thank you for finding time to join us. It's our pleasure to host you as a Kenya Healthcare Federation. At KHF, we are the private sector board for the Kenya Private Sector Alliance. And we are hosting you as the Health Regulations, Quality and Standards Committee for the KHF. To get us going, I would like to have the honors of inviting our CEO at KHF to say a word or two to invite everyone else and open for us the meeting as we get going. Dr. Deuri, welcome. Say hi to us.
Asante sana Odur. Mine is to say karibu kila mtu. Thank you for honoring our invitation. Today we take off on a very interesting and important topic of medical laboratory accreditation. What goes into quality in the labs, why is it important, and why we should pay focus in this particular area. I think if we have been keen on the happenings and the changes towards policy stability in the sector, commodity security has been mentioned as one of the things that is very important. And tied to that, we cannot have the conversation of commodity security without having the conversation of the laboratory bit, equipment that is going towards testing. A study that was, or rather an exercise that was conducted by the Standing Committee on Health in the National Assembly in 2021-2022. Lab costs accounted, I think, for up to 22% of the bill for most patients at the point of financial discharge. Therefore, it is very important that quality tests and procedures happen in the healthcare space. Tied to this, they really help our clinicians diagnose properly, and also preventive treatment is able to be brought into the picture quite fast. I'd like to stop there. We have better speakers on this particular topic than I would, and one of them is our board director, Jakudul. So karibuni kila mtu, and thank you to Doris as well for agreeing to be part of this conversation. Asante sana Odur, over to you.
Thank you, Dr. Deuri. I think you've got us started quite on a high note. And we on the panelists today, we have two great scientists in the lab space. And we are grateful to have Doris with us. Basically, Doris has served this country in the lab space as a lab scientist for almost 15 years and beyond. And she also represents this country in some key notable committees in the globe. Basically, she represents Kenya as part of the ISO technical committee. And they are basically the committee that looks at medical standards and medical laboratory devices standards. And she's also part of the team that has been making progress in terms of the revisions of the various ISO 189 versions that we've been having in the country. So I think we are grateful to have on board here to help us digest and also hold a conversation on these an important point when it comes to quality of patient care. And with Doris also, we have one of our board directors, Jakudul. Jakudul also has served this country as a lab scientist for almost 15 years now. So Jakudul basically brings us the private sector experience because he does a lot of technical support and advice to the various laboratory and healthcare organizations when it comes to accreditations and quality in the lab space. So welcome, Jakudul. To get us going, thank you. To get us going, I think we'll start off from the accreditation perspective, and Doris will just give us, in a nutshell, she will show us and try to demystify what really lab accreditation entails And she'll also touch on a little bit of some of the stuff that you need to basically take care of, be wary of, and those that you need to take note of. So Doris and Jacodun, welcome. So Doris will get us going. So as a way of getting going, Doris, just bring up your screen, a little bit of yes, thank you, and take it up. Over to you, Doris.
Okay, can you hear me now? Can you hear me?
Yes,
yes,
we can hear you.
Okay, thank you. Just a second, let me stop sharing, then share again.
So has Doris gets a presentation on show on live? Kindly, if you've got any questions or concern or clarifications, just post them in the chat box on the Q&A sections. Basically, we'll try and respond to each and every one of them. Over to you, Doris.
Okay, thank you very much, Udwar. Good evening, everyone. My name is Doris Mweni Mengo. I am the manager in charge of medical laboratories accreditation at the Kenya Accreditation Service. And first of all, I would wish to thank you so much for inviting me into this very important session that you're having. So my discussion today will be about medical laboratory accreditation and the landscape there is in Kenya. But before I probably go into the process, the do's, the don'ts, who does accreditation, I would want to demystify or define what accreditation is so that we start on the same note. So accreditation according to us, is defined by ISO and not by a normal dictionary. So accreditation to us by ISO is the formal recognition that an organization is competent to perform specific processes, activities, tasks in a reliable and credible manner. Let me make it a bit easier. So accreditation is a recognition by an accreditation body such as KENAS to perform that a medical laboratory in this case is capable or has the competence to perform specific tests in a reliable and credible manner. So now, when I say a specific test, I will not mean microbiology. I will mean microbiology, but going down to a gram stain. Is a medical laboratory able to perform a gram stain and identify a bacteria as either being gram positive or negative? Or if we talk about chemistry, clinical chemistry, is a medical laboratory able to identify if a patient is okay or sick? How is their calcium levels? How is their cancer markers? And when we come to cancer markers, we don't want to have a plethora of cancer marker. We are looking at, is it CA19, CA9, or whichever it is. We want to look at hematology now because we are being very specific when it comes to accreditation. Is a medical laboratory able to check someone's HB? So we are very specific, and our area of expertise means accreditation is being very specific to what we are going to be checking. Of course, with accreditation, we evaluate personnel. We come in and check, is the personnel of this laboratory competent? Do they have the right qualifications? Do they have the right skills? Do they have the right knowledge to be able to perform a specific test? Then the other thing is, does the laboratory have the specific supporting management system to perform all these activities that they purport to be competent? So we will be getting in, checking if the laboratory has the necessary competence in line with the requirements that have been stated in specific documentation. And now it also involves practical tests. That is accreditation. So now at this point, then we will be looking at the proficiency testing. How is the outcome of their PT? And of course, PT in the medical area would be called external quality assurance. Then we will be looking at their methods. We'll be looking at how they calculate their measurement uncertainties, how they validate their methods for them to actually say that they can produce a specific test. Of course, with accreditation, we will definitely be evaluating the equipment they'll be using, as well as measurements, traceability of this measurement. So in a nutshell, accreditation is quite different from certification because we are highly specific when it comes to the scope of work that we will be looking at. But then who offers accreditation in the world? And now I'm specifying medical laboratory accreditation. So medical laboratory accreditation would be offered by an accreditation body that operates in line with the requirements of 17011. As I go down my presentation, you realize me talking about various standards. And one of the standards that I'll be discussing about is 15189. 15189 is a standard that is used by medical laboratories to check if they're, or to implement their own management system, and of course, to be used later by the accreditation body to check if the medical laboratory conforms to the requirements of such standards. But you know, the body that is going to accredit a medical laboratory needs to be in itself competent. So in that manner, it means that the accreditation body would need to work in line with specific standards that have been established internationally. And the standard that these accreditation bodies would operate in for you to be able to trust the work of the accreditation body is one that is called ISO 17011, that is requirements for accreditation bodies. Now, if you're going to seek for accreditation, it would be important that you're seeking accreditation from an accreditation body that is already meeting the requirements of 17011. Of course, so what will you be looking at? You will be looking at specific signatories that will be put maybe in the websites, that will be put in specific websites like the accreditation body's website. We will have others that I will be discussing as we go on. But then who offers accreditation in Kenya? In Kenya, accreditation is offered by KENAS, that is the Kenya Accreditation Service, and we are the sole national accreditation body for Kenya, being established under an Act of Parliament, that is Act number 8 of 2019. You might think KENAS is very young based on that Act of Parliament. No, we are not young. KENAS has been in existence since, 2005, not even 2007, as I have indicated there, and even earlier on. So we had been established under the Standards Act. And for those who know about standards and acts of parliament and legal entities, the Standards Act is the one that establishes the Kenya Bureau of Standards. So we existed in there as a department, but later in 2009, the government gave us a legal notice and we got out of CAPS using our legal notice. Then later, of course, to have a strong mandate and a strong instrument, we needed to transition to an Act of Parliament. And so we are existing under an Act of Parliament that gives us the mandate to actually undertake accreditation in Kenya. And we don't offer accreditation only in Kenya, but we offer accreditation across board in the whole of Africa, and I will be showing you that later. So the services that we offer as KENAS include medical laboratory accreditation in line with 15189, point of care testing in line with 15189, the standard, diagnostic imaging, biobanking. This is a new standard coming in to look at issues, how we bank our samples that we use for research or other purposes. Of course, we have testing and calibration laboratories, and this would be your laboratories that test your waters, your foods, your soils, your building materials. So those ones would be accredited to 17025. You'd also realize as we go into the laboratories, equipment would need to be calibrated. So the calibration laboratories would in turn need to be accredited to 17025. Of course, we have the proficiency testing providers where we offer accreditation. We offer accreditation to this type of bodies to 17043. And I believe Jacodu will be discussing much of this much later. Of course, inspection bodies. We have quite a number of inspection bodies, but we need to check if they are competent to undertake specific processes, like someone who's going to inspect your building, the buses that we utilize, even inspecting the services that are offered by the various health bodies like Kenya Medical Practitioners and Dentists Council. They inspect specific activities. We have KMLTTB, Kenya Medical Laboratory Technicians and Technologists Board. They offer some component of inspection. So for us to trust their work, then they would need to be accredited to 17020. But then the biggest is certification bodies, where we have organization being certified to ISO 9001, to ISO 14000, that is on your environmental management system. You have food safety management system being certified. So organizations such as those would need to be accredited. And some of them include KEBS, SGS, BVQI. For them to demonstrate their competence, then they would need to be accredited. And of course, anyone who certifies personnel like Kenya Medical Practitioners and Dentists Council will definitely need to be accredited. And those that certify products that get out of this country, for example, flowers, or those that we import, would then need to be certified to 17065. So now I had told you about Kenya's need to meet the requirements of ISO 17011. Now, for we to be recognized, we would need to implement the standard which we have implemented successfully. So that makes us to be signatories of specific international bodies, which are very important when it comes to the work of trade and also testing and medical testing. So now we are signatories of International Laboratory Accreditation, International Accreditation Forum for Certification, and of course, African Accreditation Corporation. We are also members of the East African Accreditation System as well, accreditation system, and that's within the EACC. And those are our accolades, our certificates. Now, for you to trust an organization that is going to accredit you, it has to have this. Any that is operating in Africa will either have the one for ILAC, for laboratories, inspection and calibration, and of course the one for AFRAC, because we also operate within an African landscape. For certification purposes, you will definitely be under IAF. So you need IAF, International Accreditation Forum, International Accreditation, International Laboratory Accreditation Corporation, and of course the AFRAC certification. So now we operate in a number of countries in Kenya as Kenyans. So we have Kenya, Uganda, Tanzania, Gambia, Ghana, Rwanda, South Sudan, Somaliland, Ethiopia, as well as Burundi. So we operate wherever. Anyone who needs our services, as long as there is no accreditation body in that in that country, we are able to get in and do that work. But let me go directly to what brought me in for this discussion, and that is medical laboratory accreditation. So it's very important to note that the services of a medical laboratory are very essential, and especially when it comes to diagnosis and the assessment and the treatment of patients. I mean, I think it is very important for any doctor, while they are sending a patient to the medical laboratory for the purpose of diagnosis, for them to trust those results. And the only way they can trust these results is if the results are actually coming from an accredited medical laboratory. So the services of medical laboratories, as you all know, include, arrangement for requisition of samples, and the samples are themselves coming from a patient. How then do we prepare a patient before we take the samples? How do we identify the patient before we even think about removing samples? We are living in Africa where we share names. We have many Doris Mwenis, we have many Jack Odwalls because we are cousins and we are coming from the same grandmother. So now how do we identify these two different people so that we're able to take the right sample from the right patient for us to give out the right result? And how do we go around collecting samples? Remember, depending on the type of test, then we will definitely collect a different sample. Depending where the sample is coming from, then the procedure will definitely need to be different. Then how do we transport these samples and store them in the laboratory before testing? Then we will go to the aspect of how do we conduct the examination? Do we have the right procedures for us to be able to do this? Then how do we interpret the results? Very important that medical laboratory people, including the pathologists who work in the medical laboratory, should be able to interpret these results so that the doctor knows what to actually do with those results. Of course, there's a specific benefits when it comes to accreditation. But when it comes to accreditation of 15189, the benefit is mostly to the patient that comes to seek healthcare, and of course through their doctor. So of course, important to note that apart from the patient, it benefits all of us. It benefits the doctor, because the doctor knows what they're going to treat. It benefits the insurance companies, because the insurance companies know if the patient gets the right results, they don't have to keep on retesting, or the patient does not need to get on moving from one laboratory to another, hence using a lot of money. It benefits, the guardians, the parents, the government itself, very important when it comes to all these different players. So, but we say the biggest beneficiary becomes the patient. So why the patient? Of course, accreditation provides timely diagnosis. When we say it is 2 hours, it needs to be 2 hours. Unless there is a problem, then that would need to be discussed. It provides accurate diagnosis. And of course, accurate diagnosis is equals to proper patient management. So, and that is very important when it comes to our practice. And of course, the other thing is improved relationships. We all know the country we are coming from. The relationships with the service providers, actually not service providers, our clinicians, including the nurses, vis-a-vis the patients and their parents or their guardians is something that is not to be desired. But of course, with accreditation, one thing that we have seen is that there is improved relationships, how patients interact with the medical laboratory, how patients interact with the doctors themselves, improving relationships because we are reducing risks that are associated with misdiagnosis. We're improving relationships because, who isn't happy when they have a shortened stay when it comes to hospitals? And of course, definitely giving a peace of mind when it comes to our patient and their families. Of course, the best thing is the fact that it will reduce cost, because if I have laboratories, if I have facilities that are accredited in Kenya or within my my area that I operate in, that means I don't have to travel distances to seek diagnosis. Case in point, we needing to have our patients travel to India for cancer diagnosis. That's one thing that really, is a burden. Is a burden not only to the patient, but even people who are their friends, because lazima harambee itafanywa, as you all know, and that is a burden. So if we are all going to have laboratories that are accredited, then that means we shall have less travels, less expenses, and necessary costs that are associated with diagnosis. And of course, it means that referral systems will work better. And of course, the backbone of accreditation is one thing: to promote trust. So accreditation promotes trust among medical laboratory. It gives confidence that if I go to a laboratory, if the doctor sends a patient to the laboratory, that I will be given the right result for the right patient and in a timely manner. And that means then I will be able to make the right diagnosis. Of course, there are benefits for accreditation when it comes to regulators. So if you're a regulator, of course, it would be good that you use accreditation at the end of the day. But for the medical laboratory and for the users of the medical laboratory, the benefits are quite a lot. There's international recognition. There's the fact international recognition in relation to your services, in relation to your profits if you're a private sector laboratory, but also it reduces the risks that are associated with your practice. Again, it stimulates innovation. It encourages best sharing among colleagues. There's all this. It prevents unnecessary duplication. It reduces costs that are associated with you having to keep on repeating tests. Then, of course, apart from medical laboratory accreditation, we jump in directly into diagnostic imaging. So the standard 15189 is not only used for medical laboratory accreditation, but can also be used for diagnostic imaging. And here we do accredit mammography, CT scans, ultrasounds, MRIs, nuclear medicine. We have, name them. All of them can be accredited by this. And it's a very interesting area that probably we need to think about getting into as Kenyans, because of the risk that is associated with this, because of the monies, the cost that is associated by we diagnosing people using this specific kind of, equipment. It's quite pricey. But then if we would have more facilities accredited in the country, then that means the cost would definitely go down. Of course, 15189 also being used for point of care testing, and I have forgotten to put 2022 there, it's not 2020X. So point of care, of course, as you know, is a test that is performed next to the patient, near to the patient, and not in the medical laboratory. So now this test would be done maybe in the ICU, in the HDU, in theaters. It would be done in maternity wards. It would be done in emergency. So any test that is done next to the patient is a point of care test according to us, then it would be accreditable to 15189. So let me take you through the journey of accreditation. And these are the do's, what you need to put in place for you to be accredited in line with the requirements of ISO 15189. So now the first thing, where do we start from? We need to start from preparing ourselves for accreditation. And the first thing is we need to train our medical laboratory staff. And medical laboratory staff, I'm not removing doctors or pathologists, they should be part of that. The HR staff, the procurement people, they also need to be part of that so that they understand what needs to be put in place. So train your personnel to 15189. Then based on that, what you have learned, you will need to document your management system. Then of course, very important that you participate in EQA. And this EQA needs to come from accredited proficiency testing providers. Then the other thing that you need to do is calibrate and maintain your equipment. You need to perform method validation if it is a non-standard method. If it's a standard method, all you need to do is verify. Then after that, you need to do measurement uncertainty, of course, goes hand in hand with verification of methods. After you have done that, please do an internal audit. Outcome of internal audit could be non-conformities. So that means you would need to implement corrective actions as applicable. But even as you do your work, one thing you need to know, you need to be identifying risks and managing these risks. Now, you know, risk is in every aspect of our lives, including swallowing saliva. You might just be choked. So if there's a risk in swallowing saliva, even waking up, you might wake up and then your kabak just snaps. So there's a risk nearly in everything you do. You might sleep and then something happens, you fall down. That's a risk that needs to be managed. So if there's a risk in all these things that we do in life, then there would be risks when it comes to medical laboratory accreditation. And there are many that are related, not only to the safety of the patient, but the management of the laboratory that the lab would need to check. And of course, at the end of the day, the need for the laboratories to manage, to have a management review meeting. And management review meeting is where the laboratory looks back to see how they have been performing. And of course, that helps them to look forward to see how they are going to strategize for an improved service. So now, when you are planning or preparing for accreditation, you would want to divide your activities into two, and I have tried to name them management and technical requirements. Now for management requirements, and these are purely on the shoulders of the laboratory director or the person who will be managing the laboratory, will include dealing or coming up with aspects impartiality and confidentiality. Impartiality means you ideally being free from bias, being objective when it comes to performing activities that are in relation to the medical laboratory. And of course, there would be need that you are a legal entity. For you to come for accreditation, you cannot be a mafia laboratory or a briefcase laboratory. No, you have to be a legal entity. And a legal entity here means that you have to have legal instruments in the sense that you can sue and you can be sued. So now, how do we get that? You're either registered, incorporated as a company, that's for private organization, or you're gazetted if you're a government organization, or you're registered as an NGO for the faith-based organization. Now, legal entity is not it all. We need regulatory requirements. And if you're a hospital, you'd first need to be registered by the Kenya Medical Practitioners and Dentists Council. That is the first instance. Now, if you have a medical laboratory within that hospital, which is in most cases, you'll definitely have a lab within a hospital, that laboratory would need to be registered by KMLTTP. So now if you're a standalone laboratory, then you would not need to be registered by the Kenya Medical Practitioners and Dentists Council. You will definitely go directly to KMLTTB. Now, when you look at the standard, someone will ask me, Doris, lakini there is no anything like regulatory requirements in ISO 15189. Yes, it's not there. But remember one thing, when it comes to the world of standardization, regulations supersede standards. So now we have to implement the requirements that have been set by the regulators. And of course, you will find more regulations than what I have put in here. NEMA, for example, when it comes to your environmental management, you would need to implement such requirements. If you're going to fly out your samples, for example, to another country, then IATA regulations would need to come into play. The other thing that management needs to put in place or appoint is a laboratory director with the authority and competence and resources to run that laboratory. Of course, you need a structure for the organization. You need to have a quality manager. The standard does not talk about a quality manager. It says it can be given, the aspect of laboratory quality management can be given to a number of people. But seated where I'm seated today, it is good for you to have a quality manager. Otherwise, if you really don't have someone who's responsible then for quality management, there is no way that activity is going to be done. People will just be pointing fingers at whoever, and your system will definitely come down. Policies and objectives need to be there. Service agreements between providers of services, both internally and externally, as well as point of care facilities would need to be in place. Now, when it comes to externally provided items and products and services, of course, you will be referring to laboratories. So you would need to choose them as appropriate as per procedure, as per standard. And that goes to the consultants that we actually procure from. Then procurement activities as well as your EQAs. Management, still a long thing to go. You need to document your system, have risk management in place, come up with actions to address these risks, as well as opportunities for improvement. Of course, if you do an internal audit, and as you do your work, you will still come across what you call non-conforming work. And if you come across non-conforming work, non-conformities, it is just in order that you do corrective actions to eliminate those non-conformities. Of course, it will be expected that you do your evaluations, and this would include you conducting internal audits, as well as measuring your system using quality indicators. And of course, at the end of the day, having management reviews. Now I will go to the technical aspect of it, what you need to put in place. What shall I do when it comes to the technical requirements? Very important that we have all SOPs for the tests that we are going to be applying for accreditation, and those that are required and mandated by the standard ISO 15189-2022. Very important to ensure that you are employing competent personnel. And where they're not competent, please make them competent by providing necessary qualification, training and qualification for them. Then of course, participate in EQA, at least 2 cycles. For the rest will be okay. Then traceability of measurements through calibration or other means. Validate or verify your methods if they are not standard. You validate if they're standard, you have to verify. Then you have to establish measurement uncertainty, or what they call calculation of measurement uncertainty. And of course, very important that we have a management system or a laboratory information system that has been verified. So once you have all that in place, that is the management requirements and the technical requirements, it's important just to go back and check how prepared you are. And you can use this diagram that I have put in here to help you know how you were prepared before you come in for accreditation. And the only way you can use this diagram, where you're looking at your management system, the scope you bring in for accreditation, your contracts, your internal audits, your complaints, your validations, is by you undertaking an internal audit, as I had said before. Now, once you are ready, then you can go ahead and apply for accreditation. Now, Kenya Accreditation Service, as I have said, it is the sole national accreditation body of Kenya. It is government. Now, being government, application has to be done through eCitizen. So that is the eCitizen platform that I have put there that you would need to apply through. But the application process is like this. Of course, through eCitizen, submit your application form, fill the accreditation agreement, then of course, submit the documents that we will have asked for, including the legal entity, the regulatory aspects of them, the documentation, including technical and management, and cross-reference matrix there. So once we have your documents, we look at your application form and we feel like it meets the requirements, we make sure that it meets the requirements of KENAS, then we can go ahead and do a document review. So we shall be reviewing the documents that you have submitted to see if they comply to the requirements of ISO 15189, as well as any established requirements by KENAS as well as ILAC. So we can identify gaps at this stage. If there are gaps, we will definitely let you know. Then at that point, you can correct. Now, if the gaps are minimal or if there are no gaps, then we will come in to assess you on site. So now on site is we come in, bring in our assessors, coming in to check if your system complies to requirements. Now, at this point, you will be demonstrating to us, how do you undertake internal audit? How do you undertake management reviews? How do you conduct a specific test? For example, malaria, all the way from sample collection to you undertaking the test to you giving out the result. We will be that specific. We will be looking at your equipment, we look at your environmental conditions, how you deal with waste management, etc. Now, once we have finished the assessment, we might come across non-conformities. So we will identify the non-conformities and give you at least 3 months if you are a new client to close out the non-conformities. So once you close out the non-conformities and we are satisfied with the corrective actions that you have undertaken, then at that point we award you an accreditation. And the accreditation is valid for 4 years. But then within the 4 years, we shall come into your laboratory every once a year. By the way, we don't leave you, become part of us. So every once in a year, we shall be coming to you to check how you maintain the accreditation. Now, remember one thing, when we give you accreditation, we give you a mark of accreditation. And that's the reason why you should be coming for accreditation, because you need the mark. The mark means that you have been checked by KENAS, who is recognized by ILAC, and now you're competent to undertake specific tests. Now, I keep on telling people, never go for accreditation if you're not using the mark, because then what will you be selling to your users? Nothing. You only sell the mark, and that's why it's important for you to be accredited and use the mark within the guidelines that KENAS will have given you. Then, of course, you will pay annual accreditation fees. Other dues for accreditation process and the maintenance of accreditation will include ensure that the system that you're implementing belongs to you and it doesn't belong to a consultant. Own your system. Most of the time you will find people taking up consultants, what we call mentors, and the mentor comes and puts a management system in place. But then when you go to assess, you realize this system is not the labs, it's the mentors. The people in the lab have no idea what is happening. And with that, they will not be able to manage and maintain accreditation. Then the other thing is use the right data, and the data that belongs to your laboratory. Please don't go to another laboratory and fetch data to calculate uncertainty of measurements and verify your methods. We will know. Then the other thing is implement all the standards requirement. Make sure your organization is a legal entity. Now, some don'ts when it comes to the journey of accreditation. Well, the journey of accreditation can be a hard one, but it's a very worthy journey that all of us want to think about, and especially if you're a medical laboratory. Now, the don'ts that you don't want to put in place, or things you don't want to have, or things that I'm saying, please desist from, include the first one. Please don't copy other laboratories' management system. Don't go and take Jaco Dual's management system and implement in your system. And that's because systems are different. They have different, structures. They have the monies or the budgets are different. The equipment are different. The personnel are different. The cultures are different. So you cannot cut and paste. Please come up with your own management system based on how you're structured. Then the other thing is, please don't cook data. That we used to cook data for research projects in campus and wherever. And yes, please, let's not cook data. You will not be helping yourselves. You will not be helping the patient who will be coming to your laboratory to be tested. So don't cook data related to method validation, verification, and uncertainty of measurement, and any other, even reference ranges that you will be coming up with. Then do not participate in EQA from PTs that are not accredited. Please use ones that are accredited. Remember, a PT is a way of you checking if your system is working appropriately and you comparing yourselves to other laboratories. You want to measure yourself against, your colleagues. So you want to take or acquire an EQA from a provider that is providing the right material and that can give you the right results to tell you where you are at with your quality of your laboratory. Then the other thing, please don't hide your sins. Now, sins here are really non-conformities. Don't, we like putting things under the table, under the bed, thinking that no one will see. Now, those things are the ones that come and embarrass you because they will be seen. And in short, I'm saying, don't hide, bring them out in the open. And remember, you're bringing them out to the open, not to the accreditation body, but to yourselves, so that you're able to work on the non-conformities, the areas that are not conforming to requirements, and you close them out completely so that you improve on your quality management system. Because if you don't do so and you apply for accreditation, remember the accreditation body will see everything. Apparently, I don't know why assessors just see everything, but they see everything. And so I come to the end of my presentation, but I have put a different logo in there. There's two logos, the one that I've been using in green, and there's new one here. There's another one in blue. So Kenneth is transitioning. We are coming up we've come up with a new logo. We are changing our marketing strategy and all that. So hence the new logo. So what you will be seeing in the next few months is this logo that I am placing there. And thank you everyone for listening.
Okay, thank you, Doris. That was wonderful. Now for everyone, just type in your questions in the Q&A. Doris will respond to them. And we have now a senior assessor, also a senior Kenya certified assessor, Jacodul, here with us. He's coming on now to just basically tie the accreditation and lab quality. He is now basically tying the two up, accreditation and lab quality. And as Doris was speaking, our chair at the committee also dialed in. Thank you, Millicent. Welcome on board. Jacodul, pick it up.
All right. So thank you very much, Doris, for that wonderful presentation. Sorry, my camera is not up. I think my antivirus messed up my camera, so you just have to cope with me. So just listen to the content of my discussion, and then after that, you'll be able to have a deliberate point of discussion after that. So thank you very much. I think Doris has done justice to the introduction to what accreditation is, what are the do's and the don'ts, and the benefits, and also the ecosystem of how a lab should be able to get accredited. So I won't dwell so much on that particular part because I think she has taught actually for the last 40 minutes. So eventually my work is just to tie the accreditation to the lab operations and just to see how we can be able to benefit in terms of quality ecosystem. So virtually, I work for Keton. So Keton is an integrated group that deals with laboratory diagnostics, and also we do trainings, consultancies, and also provide other EQA and third-party control services, carryover services, and also linearity control materials. So these are some of the materials that are needed as an ingredient for a good operating laboratory. So my discussion will go straight to virtually something touching the lab quality. So every time we look at a lab, we should be able to look at a lab in a way that we should be able to get rapid, reliable, and reproducible results. So the lab users in this particular context, the patient and clinicians, normally expect a laboratory to be able to give a result that concurs with their clinical findings. So lab quality is at the center of how a patient is managed and how we are able to also reduce cost as a part and the ingredient of the laboratory. So we normally say a lab is a factory. For the guys who have not worked in the laboratory, they might never understand what really happens behind the computers, behind the machine. But lab is a complex system. And before result comes out, it goes through a lot of processes. So the lab ecosystem has three phases. We have the pre-examination phase, we have the examination phase, we have the post-examination phase. And most of the things normally happen during the pre-examination phase, whereby you have to get the patient naming right, the barcoding right, sample collection techniques right. You should be able to get the accessioning processes right, transport, and many other things right. So we normally say if you're able to do the 70%, the rest of the items should be able to follow, because whatever you put in at the entry point is what really determines the output of that particular process. We might be able to have a very good ecosystems in terms of the running the QCs. We've done verified our equipment. We've also running our EQA programs, but if we don't really take care of the pre-analytical process, it's normally a problem. So what makes a good lab tick? We should be able to ensure that our lab environment is good and is quite okay. We must be able to have knowledgeable staff. The competence assessments must be up to date. Reagents and equipment must also be valid. Quality control, communication mechanisms, process management, occurrence management, and record keeping processes also have to be up to speed. Also, as Doris has mentioned, a management system, if you look at the current standard, the ISO 15189, 2022 version, we've gone towards now talking about my management system other than only the quality management system, because a management system normally has all of those other processes, from the finance, procurement, to the lab operations, the planning, the quality control management, quality assurance, and also improvement, are what actually makes a management system work in your laboratory. So as you look forward to accreditation, you should be able to make sure that your management system is also up to date. So lab users normally expect accurate results. Turnaround time must be up to speed. The lab results should be reproducible, repeatable, and also affordable. So a lab user normally in their mind, be it the patient or be it the doctor or the clinician, they normally have this particular at the back of their mind. So accuracy of the reports, meeting turnaround time, reproducibility of the result, repeatability and affordability, among many others. Because normally we say the quality aspect of a laboratory should be able to be fit for the purpose, and you should be able to look at what the plant requires from your particular point. So the pillars of quality in the laboratory, I think Doris has mentioned most of them. So for you to be able to get a quality and reliable result, where you should be able to use verified or validated methods. Your staff should be able to be competent and well-trained, should participate in proficiency testing processes, IQC, and also your equipment and reagents should be up to date, up to speed. So currently, I think the standard has demystified a lot of issues with regard to examination of quality of the examination processes, whereby we have the IQC processes and also the EQA processes, whereby we have third-party controls. So we should be able to look at all those particular items in 7.3 of ISO 15189. As a lab manager, or as a lab director, or as an owner of a facility, most of the time when you hear about quality, the idea of cost also runs into your mind. So quality is also associated with certain costs, but you normally say, as the Japanese normally say, quality is actually free, because the cost you normally incur in curing a process is normally less compared to what you do in appraisal of that particular process. So there are several costs that you need to look at when you're setting up your quality ecosystem in your laboratory. And these costs are normally related towards the prevention, appraisal, internal failure, and external failure costs. So internal failure cost normally looks at what is the cost incurred when a defect is identified in-house before the product is sent out. For example, the need to retest a test process when you don't really trust the result that has come out, looking at issues of downtime, looking at the failure mode and analysis effects processes, and all those kind of stuff. So there are costs that are also related when a failure has been determined, when a result or a poor test process or defective product has gone out of your laboratory. So these particular costs normally are aligned to the business itself. The complaint, a lot of money that you're going to use in terms of complaint adjustment is quite something that you need to think about. The cost of returning that material, and also the believability or lack of trust. Remember, Doris said earlier that accreditation quality ecosystem should be able to deliver trust. So there's labs that normally give you guarantee charges. If you're able to get poor results from us, we'll be able to pay you back. So how much payments do you want to do in those particular ecosystems? Warranty claims and also loss of goodwill. And I normally say the loss of goodwill is always the killer of the business, because a business that is lost, you'll never be able to recover it. We normally also have the issues to do with appraisal costs. So these are costs that you really use when you want to look at the inspection or verification test processes. Remember, test verification is not free. You have to be able to invest in the quality materials, the software for those particular analyses, the training of your staff to be able to do a proper method verification, as enumerated earlier. There's also prevention cost. Remember, the current standard is so much heavy on risk management, so that all things that might go wrong in a system are able to be arrested before they actually go out. So we should be able to look at quality planning, training, calibration of our processes, and also process controls. So we should be able to be trained well in something normally called statistical process controls. So that's just the PF model in terms of managing cost. So there's the control cost and failure cost. And what cost do you want to deal with? Do you want to deal with the cost that actually attack your lab once the failure is monitored or detected in a lab process? Having said that, laboratories in Kenya virtually are regulated by KMLTTB, the Act of 1999. And the classification ran from A to G, and G being the complex one, whereby the viral hemorrhagic fevers and everything else are being monitored there. Class A, I don't think many labs are in it. I think most of the labs are going between B to almost F. So as per the current statistics obtained from the board, about 5,500 labs are registered as private labs in Kenya, while government hospitals from maybe level 3 to level 6 lab services that almost numbering about 5,000. So if you look at all this particular ecosystem, we are looking at almost over 10,000 labs that are operating in this country. And I think I may not have the accurate data from KENAS, but I think approximately 300 labs have achieved ISO 15189 accreditation. Maybe Doris will be able to tell us. And we have almost over 15,000 laboratory practitioners that are working in this country. So what are the futures of the medical laboratories in Kenya? When I look at the future of the med lab in Kenya, I'm always getting very excited because there are many other things that is supposed to happen for the benefit of the patient and the lab users. We are currently having a lot of talks and adopting genomic sequencing to aid towards advancing towards precision medicine, because we realize that at times when the doctor is treating cancer with certain drugs with one patient, might not work in one patient, might not work with another patient because of the genomic makeup of each and every particular individual. So there's a lot of issues that are being discussed or already being implemented on genomic sequencing. I think Africa CDC has a lot of work that's going on there. Digital pathology is poised also to transform our diagnosis. We don't have enough pathologists to be able to cope with the burden of the patients that need to be taken care of on that particular format. So digital pathology is something that is coming up, whereby a slide can be able to be reviewed by any pathologist in a part of the world. And there are a lot of digital platforms for pathology that is also really coming up. There's also the power of the total lab automation. The TLS systems are also being currently installed in the country. I think a few labs are adopting that, whereby there is total automation in these particular processes to reduce cost and also to reduce time and also to improve accuracy. From barcoding, that is to robotic sample pipetting, to automated delivery of processes, to advancement in automatic processes on all the lab tests that are supposed to be handled end to end. And these particular TLS systems are able to handle even millions of samples in a day. So this is something that is coming up quite well, and most labs that are quite big enough will be able to move toward this particular point going into the future. There's also capacity sharing partnerships that are currently going on. So during COVID, you realize that there was a lot of molecular equipments that were purchased, and most of them are lying idle somewhere. And if you look at what's happening in the West, there's a lot of partnerships in that particular ecosystem, so that all those particular equipments that we used during COVID, we are able to expand them to do other things and also to ramp up other testing mechanisms. So you realize that those particular equipments for the PCR, we should be able to use them for even the cancer diagnosis and many other things. So I normally say when you have big labs or big quality labs is normally equivalent to how big our healthcare system is. So if you don't have a good, robust laboratory ecosystem that is fully accredited, it means that our healthcare system is limping, because laboratories contribute to about 70% of clinical diagnoses that happen in the country. So it's important that it's taken up quite well. so that the lab ecosystem in the country improves quite well. So I think I'll end it there and allow for Q&A and take it back to our moderator.
Thank you, Jacodun. I think that was quite timely. You tied it up nicely with accreditation. There's one question for you that I think you need to take up. Does the laboratory information management systems have to incorporate a QC module for recording and monitoring quality control results for a laboratory to pass accreditation? I think you can take it, or Doris can take that. I think that's the only pending question online.
Yeah, I think I'll pick it up.
Yes.
So the LIMS system nowadays, I think most guys that strive to have them, they should be able to incorporate the daily monitoring of the QC systems that happens in your laboratory. So there are several guys that, or several companies that have independent QC monitoring systems. I think we have Unity software by Biorad, we have R&D also has something, and many others that may not be able to be mentioned. So a QC ecosystem that is quite embedded into your ecosystem, it's able to point for you out issues before they actually go out of hand. And you're able to look at issues to do with the trends and shifts in your ecosystem before they actually get out. So the LJs that you normally draw also the WCAG rules are also embedded there, and they're able to detect them, and they'll be able to tell you whether you're able to proceed and which rules have been violated here and there. Unless Doris want to add something, maybe.
Okay.
I think, Jacodol, you've done justice to that.
There is another one from Peter Marube. What mechanisms are you emphasizing on to help medical lab personnel employ 15189 in their activities? I think, Doris, you've seen that?
Yes. What mechanisms are you emphasizing to help medical lab personnel employ ISO 15189 in their activities? So the mechanisms would be this. Please let QMS be part of your day-to-day life in the laboratory. Let it not be a one-time thing that is done maybe in preparation for accreditation, but something that is done like, every other day. When you wake up, you need to do this. When you're going to write, this is the pen that you're going to be using. Let it be entrenched in your everyday activity in the lab. Then that will make it very easy for all this to be entrenched. But also the fact that you would need to have lab personnel trained. If you're the owner of a lab, if you're the lab director, lab manager, ensure that people are trained for them to understand what they need to be implementing.
Okay.
Thank you.
Thank you. And you've done a wonderful job, you and Jacodun. And at least now, from everyone who's able to join the call to dial in, we are able to see why we cannot divorce laboratory medicine from issues around patient safety and quality improvement. And I think Jacodun has brought it out nicely when you talk about the cost of quality. And that's where we talk about diagnostic errors. And we can't divorce laboratory medicine from that. Thank you so much. I think being that there's no any other open question, I will hand it over to our chair at the HRQIS, the Healthcare Regulations, Quality and Standards Committee at KHF, so that she can sum it up and close it up with the assistance of our CEO. Millicent, are you able to say hi and sum it up for us?
Yes, thank you very much all. Thank you, colleagues. Thank you, team, for joining this amazing presentation. And I'm seeing a request that can we get the recording for the presentation? I believe the KHF team can be able to guide us, the Secretariat. My name is Millicent Olulu. I'm the chair of the committee, and I really appreciate our speakers. Thank you, Doris and Jakodul. Very, very good insights. And this is very important, really emphasizing the importance of accreditation, especially for the laboratory. I always say diagnosis is where it's a make or break. It's where you actually, if you get it wrong, the treatment and the entire pathway becomes wrong. So it's very important that our labs are accredited, and thank you for shedding light on this. So without much ado, we really, really appreciate. And I can see even another request for recording. I think we'll consider that if we can be able to share. Thank you also, Odward, for very good facilitation and moderation. And we will also have another general accreditation webinar soon. And we just want to appreciate all the members and all the teams. If you have shared your emails, we'll be able to share. And Martin has confirmed that we shall share the recording. It will be uploaded. So please look out and note that this is important. Jakodul, not Jakodul, Odwar, I want to confirm you had mentioned our CEO is also online.
Yes, Dr. Deuri is online.
Yes, so I would like to hand this over to Dr. Deuri. Dr. Deuri, thank you for joining us.
I am here. I'd like to thank Doris for the well-presented webinar, and also to Jakodul. I had a quick question to Jakodul on his perspective on the impact of the policy changes that we are seeing, more so the Social Health Insurance Act that came into place October of last year, and how it's impacting business in the laboratory space.
Okay, thank you very much, Buena CEO. I knew you had to throw one.
Yes.
All right. I think the SHA ecosystem impacts laboratory data the same way it impacts hospitals. I think currently most hospitals are not able to actually pay for supplies. They are not able to actually get new sources of supplies from where they are, and patients are not able to get treated. So when that one happens, I think it also affects the lab ecosystem, whereby most of the tests that the patient will require are still being referred, because there is limit to tests that is allowable in terms of expenditure. So as we look at that particular ecosystem and the probability of the changes in the health flows landscape, the lab is impacted in that test utility is actually at the lowest level, whereby only the basic test that labs can be able to, that the doctor is able to request, is that does not actually fully benefit the patient, is what actually is being spread out there. So as we look at that, the diagnostic ecosystem, both the laboratory and also the imaging ecosystem, should be strengthened in terms of the reimbursements and what can be allowable in terms of what the patient is able to allow to pick up. So I think as we move forward in terms of the policy ecosystem, is something that we'll be able to really also look at with the board and you and yourself.
Thank you. I think it's clear what we need to do. We are currently on an attempt just to sound the ecosystem, and we've been in conversations with among the big labs in the space, and the trend has been since January, collections have been declining. Some people owed northwards of $1 million in terms of uncollected money. So I think it's important that we monitor this, and anyone who'd like to reach out to KHF just for trends, because this will lead to a presidential roundtable, and data is what will guide the conversation. So that is what I really wanted to tie up the message that Jakodul has answered to. Millicent, I think with your permission, we can begin. I can close up, isn't it?
Yes, please. Yes.
All right, fantastic. So receive kind regards from Dr. Gakombe, our chairman. He would have wished to be here with us, nursing a flu, and he's passed his kind regards to all of us, as well as the rest of the board. We will end there. Quite a number of activities lined up on our end. Secretariat will continually update members through the contacts and email that we are that you have supplied to us. Please update where there is a need to do so. And the organizations you come from, also encourage them to be paid up members so that we can continue to do the work we are doing at KHF. This year is an election year for KHF, and we will be releasing a timetable on the same so that the board replacements that need to happen happen. The AGM, we are hoping to target end of August, beginning September. We are just winding up with our auditors on the same, and we are hoping that we will get more members as we are doing the efforts we are doing at KHF. Asante sana to Millicent and your committee. Receive our sincere appreciation. Doris and Chakodul as well. Asanteni sana everyone, and have yourselves a good evening.
Thank you.
Thank you. Have a good evening too.
Thank you. Good evening.
Thank you.